had your baby, now it's time to think about when or if you want another one. Unless your answer is yes and right away, that means considering contraception. Dr. Michelle Yvette Francis, OBGYN and Director of Student Education at St. Luke's Roosevelt Hospital, says to take it easy the first 6 weeks after giving birth.
If you're somebody that just had a baby or 2 weeks postpartum, you probably shouldn't be having sex at all because your cervix is still potentially open. There's a potential for an infection to get into the uterine cavity. So we do recommend that patients wait until they see the doctor at their 6-week visit before they start having sex.
If you're breastfeeding, you may be able to put off using contraception for up to 6 months.
It definitely offers some benefits so long as you're breastfeeding every 2 to 3 hours and you're not giving any supplementation, no formula, no juice, no water, because it's the every 2 to 3 hours of breastfeeding that prevents ovulation.
But Dr. Francis says there are some forms of contraception that are safe to begin as soon as 72 hours after you deliver, even if you're breastfeeding.
There's a progesterone-only pill that we recommend to patients who are trying to prevent pregnancy and they're nursing. The Implanon, a rod that you put in that has progesterone only, and is also can be used during when you're lactating, and also the Depro-Provera, which is also known as the shot. It's something that you have to come to your physician's office to get, but you do get contraceptive benefits for 12 weeks at a time with each injection.
Another safe option, whether or not you're nursing, is the intrauterine device or IUD.
Both IUDs are excellent forms of contraception for women that are breastfeeding or not breastfeeding. It all depends on what your childbearing wishes are in the future.
An IUD is inserted into the uterus where it can remain for up to 10 years.
There are 2 major types of IUDs. There's one with hormones, in short, and the other one is without hormones. This is the one that has no hormones. It has, it's a soft plastic T, and it's got a copper coil around the base of it and a little 2 copper sheaths on the T part of the IUD. And this has to be placed into the uterus at your doctor's office. And then my other favorite is the brand name is called the Mirena. And the difference between this and the copper T contraception is that this T has a hormone in it. It's a progesterone that's part of the actual T itself.
There's also the standard condom.
We all know what this is. Everybody has heard of it. It's the only form of contraception that's available that prevents sexually transmitted disease. When you use it with spermicide, it's about 92 to 95% effective. And without spermicide, it's a little bit less.
And for females, the diaphragm.
This has to go into a woman's vagina and over her cervix. The diaphragm has a cup and it's got like a rubber firm ring on the inside, and it's covered in latex. So if you have a latex allergy, this might not be the best form of contraception for you. This should be put in well before intercourse, about 2 hours before you have sex. You put about a tablespoon's worth of spermicide into the diaphragm. You have to squeeze it and put it into the vagina. Again, make sure that it covers the cervix. This needs to be fitted at your medical doctor or nurse practitioner's office before use.
But don't use your pre-baby diaphragm without seeing your healthcare provider first.
The cervix never goes back to where it was. If you use a diaphragm before you got pregnant, had a baby, and then you come back, you can't use the same diaphragm. And if you do, you have to go and make sure you get fitted by the doctor or by your nurse practitioner, whomever is you're consulting with, to make sure that it's fitted properly.
Another option is a contraceptive sponge like this one. A woman inserts it deep into her vagina where it acts as a sperm barrier while also releasing spermicide. But be careful, once you've had a baby, this little sponge might not work as well as it did before.
The contraceptive effectiveness does decrease if you've had a child vaginally versus not. So if you've never had a baby before and you use it, the typical failure rate, which means that you're using it like a human being and you make mistakes and you're not doing it perfectly, about 16 out of every 100 women over the course of a year that use this will get pregnant. Whereas if you had a baby before, about 32 out of 100 women will get pregnant using this form of contraception.
Once you're finished breastfeeding, you may decide to switch contraceptive methods.
If you've started on a birth control pill that's progesterone only, I would recommend changing it after you decide to stop breastfeeding.
Hormonal contraceptives that contain both estrogen and progesterone are safe to begin anywhere from 6 weeks to 6 months after you give birth, depending on your physician's recommendation.
There are hormonal forms of contraception, and that can come in the form of a pill. It can come in the form of a ring, a vaginal contraceptive ring. There's a contraceptive patch, and there's also a new contraceptive device called the Implanon. It is a hormonal implant that you can put into your arm and protects you against pregnancy for up to 3 years.
With so many options, there's something for every lifestyle. Your healthcare provider can help you choose the right one for you.
The best form of birth control for women is the one that they're going to use, and the one that they're going to use regularly and effectively.